I'm Christy Diaz in the 11 Alive newsroom. We are following breaking news right now. As of 10 o'clock Saturday morning, the Department of Public Health has confirmed 3 more cases of the coronavirus in Georgia. Now, first things first, we want to bring you the facts, not fear. So the first thing we want to tell you is that the overall risk to the public is still low. And at this point, there is no evidence of community spread in Georgia. So here's what we know about these 3 new cases. We received a press release around 10 o'clock Saturday morning from Governor Kemp and the Georgia Department of Public Health on 3 cases, one out of Cobb County, one out of Fulton County, and another one out of Floyd County. Here's the breakdown of those 3. Now, the case out of Cobb County, that patient recently returned from Italy and is currently isolated at home. The second patient is from Fulton County and we're told is currently hospitalized. Right now, they do not know how that patient was exposed to the virus. Out of both of those cases, out of Cobb and Fulton, the testing were both done by the CDC. Now, in the third case, the patient out of Floyd County, that one is confirmed that patient remains hospitalized. Now, also out of Floyd County, there are at least 20 employees at Floyd Medical Center who are under a 14-day self-quarantine. After coming into contact with a patient, they will be self-quarantining at home for the next 14 days. Now, here's another thing out of the press release we received this morning. Gwinnett County now has a presumptive positive case of the virus, and the Georgia Public Health Lab tested that person on March 6th. That individual recently returned from Italy and was self-monitoring. We're told that person is now isolated at home. So let's put this in context for you. It was only at the beginning of this week when Georgia got its first confirmed case of the virus. That was on Monday night in a late night press conference from the governor, Brian Kemp himself. That was the case of a father and a 15-year-old son who both live under the same roof. Now, we're also told by the end of the week, the state had the ability to test COVID-19 kits at the Georgia Public Health Laboratory in Decatur instead of sending all of the labs, all of the tests to the CDC. Also, the CDC plans to ship out at least 1 million test kits by today. So now, to keep you updated, we want you to know how to protect yourself. Symptoms for the coronavirus: look for fever, cough, shortness of breath, or difficulty breathing. Symptoms can show up between 2 days to 2 weeks after exposure. And of course, if you have these symptoms or if you've had contact with anybody who is suspected to have COVID-19, stay home. And the best thing you can do is call your healthcare provider or your local health department right away. They have been trained by the CDC and the Department of Public Health. And if you call them before you go to your doctor's office, they can prepare, tell you where and when to come in to keep you away from the public. Now, another thing that is important on how to keep yourself safe, here are some tips. Go ahead and wash your hands often with soap and water. Seems like common sense, but it really is the best way to prevent the spread of germs. And do that for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your eyes, your nose, your mouth with unwashed hands, and avoid close contact with people who are sick. Go ahead and stay home. Use that PTO when you are sick. Cover your cough or sneeze with a tissue and then throw that tissue in the trash. Go ahead and wash your hands again. And then clean and disinfect frequently touched objects or surfaces. That includes your cell phone. Now, again, to recap, there were 3 new cases of the coronavirus confirmed in Georgia Saturday morning. We'll continue to keep you updated on this story. All of the new updates will be up on 11alive.com.